Welcome to our Pharma Topics channel. Welcome to the series related to BSc degree and diploma in cardiac technology. Go through all the series videos which will be useful for your routine exam preparations. The first unit is related to routes of drug administration and cardiotoxic drugs. Cardiotoxic drugs actually they affect the heart. Let us see what are the drugs which are cardiotoxic. So this is the list of drugs: bupivacaine, anthracycline, anti-cancer antibiotics like doxorubicin, daunorubicin, mitoxantrone, emitin, amphotericin B, trastuzumab, and fenfluramine. Some of the combinations also cause cardiotoxicity. One is halofantrine with mefloquine, which is anti-malarial drug, and some of the drugs are banned because of the cardiotoxicity. The classical examples are chloroform and grapefloxacin. The routes of drug administration are two kinds. One is local administration and systemic administration. Systemic administration is subdivided into two classes. One is enteral route of drug administration and parenteral route of administration. Enteral route includes oral, sublingual, and rectal routes of drug administration. Parenteral includes injections, inhalations, and transdermal routes. So you can see from this diagram, there are different topical preparations, different enteral preparations, and different parenteral preparations, such as otic, which is related to ear, ocular related to eye, inhalation in the nose, oral, sublingual, beneath the tongue, buccal, which is in the cheek region, pouches, transdermal patches, epidural injections in the spinal cord, and rectal administration, and parenterals, which are through the venous or arterial routes. The enteral routes of drug administration, we will see the route, the benefits, its drawbacks or limitations, and some of the classical examples. Oral route is the very commonest route of drug administration because it is very cheapest, convenient. The patient can self-administer, and it is the safest route of drug administration. But the drawbacks are all the drugs they pass through the liver before entering into general circulation. So many drugs may get affected through this. So that is called first pass metabolism, and there is a inter-individual variability in the drug absorption because of various factors like lipid solubility, food intake, and digestive enzymes. You should remember any drug, the name, if it completes with a tide or ase, suppose octreotide, nesritide, asparaginase, all these are peptides. So any peptide could not be given by oral route because they get digested by the digestive enzymes. The next is sublingual route of administration. The advantage is there is no first pass metabolism. It has a faster drug effect, and if the patient desires, he can spit the drug. Drawbacks are it may cause tooth discoloration and decay, and there are cardiac side effects also. Some of the classical examples of this route of drug administration is nitroglycerin, isosorbate dinitrate, nifedipine, ephedrine, ergotamine, and buprenorphine. The rectal routes of drug administration, 50% it is having less possibility for first pass metabolism, and it bypasses the liver. Some of the unpleasant and irritant drugs can be given by this route. It is suitable for children also, but there is unreliability in the absorption. Example, diazepam for febrile seizures. Paracetamol could also be given as a rectal suppository. The parenteral routes of drug administration, you can see the angles for inserting the injections. If it is a 90-degree injection, it's intramuscular, and it is deep rooted because it enters into the muscles. And the next is subcutaneous injection, 45-degree angle, and intravenous injection, it is 25-degree, and intradermal, it is 10 to 15-degree because it is a topmost region in the skin. Let us see the different parenteral routes of drug administration. First is intravenous route. It has 100% bioavailability. It is the very fastest acting route, so it is preferable in case of emergencies. Irritants and large volume could be administered. Peptides could be administered by this route of administration. But the drawbacks are increased chances of acute toxicity, hypersensitivity reactions may occur. Drugs in oily medium could cause hematological toxicity, and such drugs are contraindicated by this route. Examples are IV drugs of choice are nicardipine. It is useful in hypertensive emergency by this route, parenteral route. Crucimide in IV in case of pulmonary edema. Adenosine is useful for paroxysmal supraventricular tachycardia. Lorazepam, it addresses the emergency epilepsy, that is status epilepticus. Intramuscular route, the drugs in oily medium and irritants can be given by this route, and self-administration is also possible. Drugs in oily medium can cause pain at the site of injection. This norepinephrine is contraindicated as it causes muscle necrosis due to potent vasoconstriction by intramuscular route. Intramuscular drug example is adrenaline, which is useful in anaphylactic shock. The subcutaneous route provides a prolonged duration of action due to slow absorption. Irritants cannot be given by this route because necrosis can be visible. Examples are, the classical example is insulin, contraceptives, and adrenaline. The other parenteral routes are pulmonary routes of drug administration, that is faster effect due to rapid absorption through the capillary network, and local effect is possible in case of bronchial asthma and chronic obstructive pulmonary diseases. The drawbacks: irritants can cause bronchospasm. Example, insulin, zanamivir, tobramycin, short-acting beta-2 agonists in case of bronchial asthma, and anticholinergics in case of chronic obstructive pulmonary disease, and inhalation corticosteroids could be administered by pulmonary route. The transdermal route has a longer duration of effect. Only lipid-soluble drugs could be given by this route, and the examples are nitroglycerin, fentanyl, scopolamine, nicotine, hormone replacement therapy, and clonidine. Intranasal route of administration, it has rapid absorption and faster effect. It is preferable for peptides. It is possible only for potent drugs because of the variability in drug absorption. Example, desmopressin, which is used to prevent nocturnal anuria, GnRH agonist, calcitonin, and fentanyl. The other local routes of drug administration are, one is topical route. It is useful for the local effect. Example, steroids could be administered by cutaneous route. Anti-glaucoma drugs could be given by ocular route. Some drugs, anti-cancer drugs in case of bladder cancer, could be given by mucosal route. The intrathecal route is a drug administration into the subarachnoid space such that it reaches the cerebrospinal fluid. Because it is useful for the drugs which poorly crosses the blood-brain barrier. Example, aminoglycosides. Example, methotrexate in case of childhood leukemia. Anesthetics like bupivacaine, baclofen for muscle spasm. Aminoglycosides in case of CNS infections. Intra-articular route, it is administration of drug into the intra-articular space. It is useful in case of arthritis patients. Steroids. An intra-arterial injection into the arteries. Example, anti-cancer drugs which could be useful in treatment of hepatocellular and head and neck cancer. Let us see the different routes of administration and the different time duration, that is the onset of action for each route of drug administration. The fastest routes are intravenous route and the intraosseous route. It acts within 30 to 60 seconds. Endotracheal route of administration and inhalation route acts within 2 to 3 minutes. Sublingual route, it acts within 3 to 5 minutes. Intramuscular route acts within 10 to 20 minutes. Subcutaneous route acts within 15 to 30 minutes. Rectal route acts within 5 to 30 minutes. Oral route, usually the drug is absorbable within the effect is observed within 40 minutes to 90 minutes. And the variable route, it may take minutes to hours, is a transdermal route of drug administration. So it's a nutshell information of all the routes of drug administration with their advantages and disadvantages. I hope it will be useful for you. Thank you for listening. Happy learning. Kindly share this to more of your friends. If you like this video, kindly press the like button. Go through all the series which is available in the Pharma Topics channel and encourage us. Thank you.